We have another poster coming up about, we're talking a lot about falls today. So we have an algorithm a day, keeps the falls away. And we know it's going to be AI focused. So welcome Kristina Choa and Tiffany So.
All right, so hi, my name's Tiffany.
Hi, my name is Kristina. We just wanted to thank our research professor, Dr. Arikian, who's here today with us. We also wanted to thank our research mentor, Dr. Yusufova. I'm not sure if she was able to make it today, but that's okay.
So, like we said, our poster is called An Algorithm Day Keeps the Falls Away, and in this we use the PPCO format. And we're asking, in older adults at risk for falls, how well do AI-powered fall risk prediction models predict falls? And we were particularly interested in falls just because it was a really big thing that we learned in nursing. Like in class, they're always talking about how we should prevent falls and who's at fall risk. And we looked at particularly in older adults because, as you can see, 26.5% of adults, older adults globally experience falls, and these often lead to either fatal injuries or injuries that can impact ADLs and just everyday life. They also result in healthcare costs like emergency care or prolonged hospitalizations. And so AI is a really burgeoning field currently in healthcare. It's being used to look at imagings or help diagnose things. And so we looked specifically at how it would help predict fall risk in older adult patients. So we looked at a couple of databases and delimited our search based on our question. And out of this came 20 studies. And so from these 20 studies, we found the top 6 models that had the highest accuracies. So these were support vector machines, neural networks, and gradient boosting. And then those are the top 3, and then the other 3 were random forest, decision trees, and logistic regression, which were a little bit less accurate, but still had pretty high accuracies. And this was made based on using a metric called AUC, or area under the curve, which is a metric that helps predict how accurate AI models are. And so basically what the AI models do, they all do pretty similar things in a little bit of different ways, but what they do is basically classify people into either a fall risk or a non-fall risk using different statistical methods. And so you can see that we had 20 different studies, and another technique that we found was something called feature selection, which improved accuracy by 9%. And what feature selection does is it picks out the most predictive factors in a model. And so what these AI models found was one of the biggest things that helped to predict falls is previous fall history. And so that's pretty much it. We looked at AI and falls.
So we had many limitations to our studies. Many of our studies were actually conducted internationally, so countries such as China, Switzerland, Turkey, making the results not generalizable to the United States. Also, the statistical analysis was limited to the area under the curve, so other statistical analysis methods may be used or explored, such as specificity and sensitivity. And as you could see, a majority of our studies, 8 out of 20 of our studies, were actually retrospective cohort studies. So in those studies, historical data was used as opposed to real-time data. And also, these AI prediction models were not currently compared to the fall assessments that we use today, such as the Morse fall scale, as well as the timed up and go assessment. So for our major EPB recommendations, although the technology for AI does exist today, and companies are currently offering demos in nursing homes, further research is required to evaluate clinical applicability, such as usefulness and reliability. And hopefully, after further research is completed, we can implement AI to predict falls in not only nursing homes, as well as hospitals and personal homes as well. That's pretty much it.
Any questions?
Previously, we were talking about the types of surveys and questionnaires to find out if a patient is vulnerable or at risk for falls, like Morse fall scale and like St. John's. We're hearing about a new one. So I was wondering what type of scale do these AI models use, or do they have a scale? Like what type of questions are they asking to analyze that data and then to spit out the result?
So it's not really quite a scale. What they do is that there are two main ways that we saw them taking data to train AI models to predict falls. One was either using like real-time data in the sense that they were putting accelerometers or sensors to predict gait or balance and postures and using that to train AI models to predict falls. Another one they used was basically train them on electronic health records, putting in data from electronic health records to see if people had fallen. And so you can put in a bunch of parameters basically, and then the AI model will basically refine the search and then tell you whether someone's a fall risk or not.
Great. Any other questions? Excellent job, ladies. Thank you so much.